mentioned I'm 70, and let's say because of your company 5 years from now, what's going to change in my world or somebody like me? What's going to be the one thing because of what you're doing that wouldn't have been true back in 2024 if we're talking about 2029?
So Vori Health, we are a virtual first nationwide musculoskeletal medical practice, and we actually partner with Chemtai. So what would we do that would make your life different in 5 years? We would keep you healthy, active from the musculoskeletal standpoint, and which ties into all these other conditions. If we want to help fight dementia, if we want better vision, we have to stay physically active. And so we know that means addressing all the aches and pains and low back pain that everyone gets. So we are personalized, we're convenient because we're virtual, we're physician-led, because we know that while physical therapy is essential as part of an MSK plan, it in and of itself is often not sufficient. And so we're going to help you stay active, which is going to increase your longevity and keep your brain healthier and your vision better. And we're going to lower your risk of inappropriate surgery, which I'm sad to say is still, widespread here in the USA, because our focus is to try and get you better without surgery. If you need an operation, we're going to get you to a good surgeon.
So my three-part question is, what are you doing within your very innovative spaces to put trust in, and trust being as important to technology? Who's going to pay for what you're doing, and where do those benefits accrue? And how can you make sure that the new technologies aren't just helping Steve Klasko in Miami, but helping Mrs. Jones in North Philadelphia that might not have access to a Oura Ring and Apple Watch and the technologies that you're doing?
Those are great questions. So one of the in terms of who pays, we favor value-based contracts and contracts in which the patient is not having to pay out-of-pocket expenses. And in our model, where the patient's surrounded by a care team led by a specialty physician, and they have a physical therapist and a health coach, and we'll pull in a registered dietitian if needed. So none of those visits are going to result in an out-of-pocket expense for the patient, ideally, because then they engage, and then we can get them on their care journey and making improvements quickly. So the accessibility part of virtual is so important, because when we think about seniors and those with mobility issues and difficulty with transportation, which was already mentioned by Seth, the ability to access virtual care, and in particular virtual specialists, really helps drive health equity. So most Americans have access to the internet, not all, but most. And so again, making your program, we're available. You can use this on your phone, your desktop, your laptop, wherever. That's important for equity, particularly for people in underserved communities, those in rural America where they don't have good access to specialists. And trust. How do you build trust? Healthcare still remains a patient and caregiver interaction. And I will share that I think our interactions with our patients in the virtual environment are actually better than in person, where most of the time the clinician is being distracted by the EMR and the computer. You can't do that in the virtual space. I'm with you, right? One-on-one in the virtual space. So I really think that helps drive a high level of trust. And again, you have to have compassion and empathy and really keep the patient at the center of the care plan and what you're doing.
It's hit me coming over from the traditional healthcare ecosystem to General Catalyst that the humans that are involved in your team are incredibly important. And all of you have curated, because it's all your money, who you have on your team. So in 3 to 5 words, if you could just say, what defines the culture of your team that really makes it unique, that will get somebody to want to invest in you?
Growth mindset, human-centered, and change makers.